The surgeon who builds on stable ground. There is a certain kind of physician who measures success not by the volume of cases completed in a week but by how a patient moves through a room years later. Dr. David Pincus is that kind of surgeon. From his practice in Smithtown, New York, the board-certified plastic surgeon and founder of Pincus Plastic Surgery has spent the better part of 2 decades developing a reputation grounded in restraint as much as skill. His work spans breast surgery, body contouring, facial rejuvenation, gynecomastia treatment, injectables, and skin tightening. But what distinguishes him is less the breadth of his offerings and more the deliberateness with which he approaches each case. He is, by his own account, someone who never wanted his practice to feel transactional. A long road back to Long Island. Dr. Pincus's path to his Smithtown practice was anything but direct. After earning his undergraduate degree from Florida Atlantic University in Boca Raton and his medical degree from the University of Miami Leonard M. Miller School of Medicine, he completed a 7-year general surgery residency at Jackson Memorial Hospital in Miami. He was then recruited by the chairman of the plastic surgery department to serve as a research fellow, a distinction that speaks to the precision and intellectual rigor he brought even early in his career. His formal plastic surgery training came next, at Lahey Hospital and Medical Center in Burlington, Massachusetts, where his rotations extended to Brigham and Women's Hospital, Boston Children's Hospital, Maine Medical Center, and Emerson Hospital. It was an education built across institutions, each adding a different layer of technical and clinical depth. When he returned to Long Island, it was with a clear sense of purpose. He spent several years at Romanelli Cosmetic Surgery in Huntington, New York, before founding Pincus Plastic Surgery in 2019. The move toward independent practice was not incidental. It reflected a specific vision for what a surgical practice could and should be. The architecture of a consultation. At Pincus Plastic Surgery, consultations are not rushed. That is not a marketing phrase. It is a structural decision. Dr. Pincus believes the consultation itself is diagnostic, not just procedural. He evaluates proportion, balance, and structural integrity before any plan is developed. He assesses what a patient's anatomy allows, how certain changes might affect long-term aging, and whether the treatment being requested is, in his clinical judgment, actually in the patient's best interest. This last point matters. There are surgeons who treat every request as a mandate. Dr. Pincus does not. He describes his approach as one rooted in honesty, even when that honesty complicates the conversation. If a request could compromise balance or safety, he says so directly. He has observed, consistently, that most patients respond not with frustration but with gratitude. His concept of structural integrity extends across every procedure he performs. In facial work, it means preserving the ligaments and muscle positioning that allow results to age naturally rather than unnaturally. In body contouring, it means respecting tissue layers and skin elasticity to prevent complications. The goal is always to build improvement on a stable foundation, not to chase surface changes that may not hold. The difference between good and exceptional. Dr. Pincus draws a careful distinction between a good cosmetic outcome and an exceptional one. A good result, in his framework, addresses the primary concern. An exceptional result integrates seamlessly with the patient's overall appearance. It does not draw attention to itself. The procedure, in effect, disappears. He pays close attention to what he describes as the interaction between features. Enhancing one area without considering surrounding structures can create imbalance. That imbalance, however subtle, is readable. It registers, even when a person cannot name exactly what they are seeing. Exceptional outcomes, by his definition, produce the opposite effect. Patients feel aligned with their appearance. That alignment, he observes, tends to move outward. They carry themselves differently in professional settings, in personal milestones, in ordinary moments. The change is often quiet. It does not require a dramatic transformation to be meaningful. Education as clinical infrastructure. The patient relationship at Pincus Plastic Surgery does not begin at the operating table. It begins with information. Dr. Pincus has built education into the structural framework of his practice. He explains every step of the process, from preparation through recovery, including what physical sensations to anticipate, how swelling may progress, and when patients can expect to resume normal activity. He addresses misconceptions patients may have absorbed from other sources. He encourages questions at every stage. This is not incidental courtesy. In his view, education shapes expectations, and expectations shape satisfaction. An informed patient follows post-operative instructions more carefully. A patient who feels respected and included in decision-making is a more active and cooperative participant in their own recovery. The philosophy also serves a longer-term purpose. Patients who understand what to expect return for future consultations with realistic frameworks. They know what is possible, what their anatomy permits, and how aging may influence decisions years from now. That shared understanding is what makes long-term planning possible and, in Dr. Pincus's model, routine. Thinking in decades. Long-term planning is one of the quieter distinguishing features of his practice. During consultations, Dr. Pincus discusses not only immediate goals but how results may evolve over time. He accounts for skin quality, likely aging patterns, and lifestyle factors. When patients return years later, he can reference prior conversations and adjust plans accordingly. This continuity, he notes, prevents overcorrection. It also prevents a particular kind of drift, where each intervention addresses only the present moment without accounting for where a patient is heading. The accumulation of individually reasonable decisions can, without long-term perspective, produce results that feel fractured over time. His concern is coherence. He wants a patient who returns at 40, 50, or 60 to feel that their appearance reflects a thoughtful, continuous story, not a series of disconnected procedures. Dr. David Pincus and the practice ahead. Awards from the International Association of Top Professionals and Preferred Health magazine have recognized Dr. Pincus's standing in his field. A feature in Long Island Press added regional visibility to a practice that has, by most accounts, been built primarily through patient trust and clinical consistency. What he describes as the foundation of his work, however, is not recognition. It is a set of commitments he does not expect to change regardless of how the industry evolves. Safety, precision, and integrity, in his account, are not subject to trend cycles. New technologies will continue to emerge. He will continue to evaluate them carefully, adopting only those that meet his standards for safety and patient benefit. The pace of that evaluation is deliberate. He is not interested in rapid expansion. He is interested in consistent quality. And in a field that often rewards volume, that orientation is its own kind of statement.